that since we have started. PROTECT is a comparative project. What we compare is refugee protection or contributions to the international refugee protection in South Africa, in Canada, and in the European Union. Of course, we are looking at different aspects of international protection analytically. I will come back to that soon. Our focus in our comparisons is the impact of the Global Refugee Compact and the Global Compact on Migration on the legal and institutional frames, as well as discourses and attitudes to the international refugee protection. Whether the Global Compact on Refugees is contributing to a better protection is the most important thing that we want to assess during this, during the implementation of our project. As you know, the Refugee Convention of 1951 puts obligations to its signatory states about refugee protection, and it has a very systematic list and description of the responsibilities of the signatory states. However, within this list, there is not much about how states should collaborate with each other in order to, in order for the international refugee protection to function properly and do its functions as intended by the signatories and creators of the Refugee Convention. So this last collaboration, international collaboration piece is put on the table by the Global Refugee Compact. It is exclusively, almost exclusively focusing on collaboration between states in order to promote a global refugee protection system. We are trying to look in this project and see whether there is anything happening in this respect. I was, for example, in the first Global Refugee Forum in December 2019 in Geneva, and I observed how states and international organizations and transnational refugee aid organizations were behaving during this conference. Basically, there were repetitions of, when you look at the pledges that came from the states, there were basically repetitions of what they had been doing and little about the collaboration aims of the Global Refugee Compact. But this is developing quite slowly now, and this is also the intention of the UNHCR, as far as I understand. They put something on the table and they use it as a means to promote some objectives. And there is some development towards the collaboration, international collaboration objective as well. Basically, and in the simplest possible terms, we are doing three things in PROTECT. The first one, as Joe also touched upon, is an exploration of the links between the United Nations Global Compact and the pre-existing international legal instruments and norms, with a special focus on the human rights experiments. We are looking at whether the Global Refugee Compact can be used to connect the refugee protection practices more strongly to high international human rights standards. The second thing, this is the task of the lawyers in our project. And the second thing that we are doing is an attempt to identify the legal and institutional frames for international refugee protection and asylum seeker reception and protection that have historically functioned best before. The reason for why we are doing is that neither the European Union's new common European asylum policy, nor the Geneva Convention of 1951, nor the Global Refugee Compact is giving any ideas or clues about how the objectives that they have put forth can be achieved with what kind of institutional frames. The knowledge about institutional frames is missing, and the objectives about which institutional frames can be used is missing. So we are trying to find the institutional frames, international and national institutional and legal frames that have functioned best in connection with the objectives that are identified in the Global Refugee Compact. And the third thing that we are doing is, again, an attempt to uncover the factors that lead to negative, skeptical, and endorsing attitudes and discourses towards international refugee protection and towards the global compacts, UN global compacts. This is because of two reasons. If the Global Refugee Compact is to be implemented, we come into the domain of policy making and policy implementation. And each policy making and policy implementation requires the support of citizens. So already now, by looking at support to different aspects of international refugee protection that we have had in the past, we are trying to predict which parts of the Global Refugee Compact implementation might create negative or endorsing attitudes within the populations. This we are doing by conducting a survey among around 30 countries in the world, and by scanning all the internet editions of traditional media and social media in order to find the sentiments about special components of the refugee protection. And we are also trying to find some causal factors that can be used by policymakers in order to change attitudes in human rights directions. Okay, I'm about to finish. This expert forum is part of the first aim, exploring the links between the global compacts and the pre-existing norms and legal instruments. I look forward to hearing more about the experts who were so kind to accept the invitations by Joe and Nicholas, about their creative ideas on how to bring the refugee protection regime in South Africa or other places closer to high international human rights standards. And lastly, I would like to thank to Joe Very for bringing together such an excellent group of researchers at the Wits University to help us conduct this project. And I would like to thank also Nicholas Maple, who has the responsibility for this expert forum, and the other team members that Joe is working with. And again, my special thanks to the speakers and discussants who will be leading us through the complexities of COVID-19 refugee protection in South Africa. Thank you very much.
Wonderful, thank you so much, Hakan. And I am delighted to now hand over to a long-term friend of the ACMS and a research associate of the Centre, Dr. Caroline Kyato, who is an independent researcher and writer. Caroline has the unenviable task of trying to manage a stellar cast for our panel discussion. As you would hopefully have seen from the program that has been circulated, is we are setting this up as a range of initial interventions and more of a discussion and a conversation. And so Caroline will be facilitating that. So as I mentioned earlier, please do make use of the Q&A function at the bottom of your screens to raise any questions, add any comments, so we can feed those into the discussion. Thank you very much, and over to you, Caroline.
Thank you, Jo, and good morning, everybody. I am joining you from Atlanta, where it's 6 o'clock. So forgive me if my voice is a little croaky, but I really am excited about this discussion because it really is an important one to have, especially now, in really trying to explore and understand how the global compacts on migration and refugees is really being embedded in the countries or in different regions and countries. And today our focus is on how the experience of the GCM and the Global Compact on Refugees is shaping migration protection in Southern Africa. So before I start, I just have a very brief, I'll just do a very brief discussion, introduction of all the panelists, and then give them the first opportunity to respond to some of the questions that we have for them, we have in store for them. So on my list is, and please forgive me, Angele, I hope I pronounce your name. I was trying to kind of practice today, but I hope I pronounce it right. It's Angele Dikongwe Atangana.
It is Angèle Dikongwe Atangana.
Oh,
Angèle like Angela.
Oh, it's the French version. Okay, Angèle Dikongwe Atangana. The United Nations High Commissioner for Refugees, and she's the Deputy Director for Southern Africa. Welcome today, Angèle. Lily Sanya, who is from the International Organization for Migration, and she's Chief of Mission in South Africa. Welcome, Lily. Barnaby Kangoni, the Health Director at Jesuit Refugee Services. Welcome, Barnaby, and thank you for coming on board on such short notice. Then we have Sharon Ekambaram. I'm sorry if I butchered your name, please forgive me. Sharon is at the Lawyers for Human Rights, and she's the head of Refugee and Migrant Rights Program. And lastly, but not least, we have Professor Lauren Landau, who's at the African Center for Migration and Society at Wits University and Oxford University. We have apologies from Celine Bakumuhari from the African Union, who was unable to attend today. So thank you very much to the panelists for being here. And I think Professor Hakan Sichakan, I think, really provided a good framework for opening up this discussion. And really is to understand, and perhaps from Angèle, especially from Angèle and Lily, is how, is what your experience is with the embedding of the global compacts in South Africa or Southern Africa, where has your experience been? What has your experience been? What are the issues that are coming up as countries really try to grapple with embedding and implementing the GCM frameworks and GCR frameworks? Please go ahead, Angèle.
Thank you, Caroline. And I have a few slides for you guys. So I would like them to be on the screen. Yes, so basically that's just to introduce, but I have 5 slides, but the substantive one are 3. Slides 2 to 4 are the substantive ones. So, but before delving onto my slides, I really want to say a big thank you to Professor Hakan, because really I felt very galvanized with his introductory remarks, in the sense that I've been working with UNHCR. I'm in my 27th year of work with the UN and UNHCR specifically. And I do recall that when I joined this organization, we used to say, well, refugees are our soup and we eat it alone. And we really very much used to feel like refugees are our babies and we have to cater for them. And I kept thinking that this is really a very, it's an illusion, because here we are, refugees continue to grow, and we really from day one have ever needed great or broad partnership with everybody, all stakeholders, starting from host governments, donors, partners, to implement a number of activities. So it has always been the portfolio of the whole world. So for us, some of us really who have grown up in this organization, it's like a colleague of mine says, God has smiled to us, because it has been like a prayer for us to arrive at this juncture where we are today, whereby it is indeed acknowledged that forced displacement and refugee matters indeed are of a global purview, and really are matters that should call for the attention of the global world and the global stakeholders. So really, this was just an introduction to that. So to go to my first slide, I really, the first substantive slide. So slide number 2, please. I really want to say that the New York Declaration for Refugees and Migrants in 2016, the famous Obama summit in the margin of hunger that year, and the subsequent adoption of the Global Compact on Refugees in December 2018, marked a turning point in recognizing the imperative of greater responsibility sharing to achieve sustainable solutions to refugee situations. To translate into action this undertaking, the Comprehensive Refugee Response Framework, CRRF as we call it, was rolled out in more than 12 countries in the world as the first effort to demonstrate a multi-stakeholder approach involving national actors and international community, and to address the plight of refugees while also supporting the development of their host, and to further mobilize practical action by state and non-state actors. The Global Refugee Forum was held in December 2019, as you can see on the roadmap, which is displayed on the screen. It generated around 1,400 pledges in support of protection and solutions for refugees, or for UNHCR's persons of concern, as we call them, and the development of their respective host communities. You can see the roadmap there of the major events that have taken place indeed to implement somewhat or to operationalize this undertaking that was made, or the proclamation that was made in New York in September 2016. Slide 3, please. Slide 3, as you can see, really shows that countries in the region of Southern Africa, and I beg pardon, I would not limit myself to South Africa. I am the Deputy Director for Southern Africa. We cover 16 countries, including, of course, South Africa, where we are based. And so this sub-region has really shown a great goodwill to implement the GCR, the Global Compact on Refugees, and Zambia and Malawi have really been at the forefront. Zambia actually could be called the pioneer of the comprehensive refugee framework, the approach, the whole of society approach. And indeed, 14 states out of the 16 that we are covering in this sub-region have submitted substantial pledges for the at the GRF last year. Zambia is a pilot for the CRRF implementation, having adopted this to respond to the 2018 emergency situation arising from the arrival of refugees fleeing the conflict in DRC. The process saw an all-government involvement as well as participation of host community leadership, UN agencies, and other organizations in the development and implementation of national roadmap addressing immediate humanitarian needs, but also taking steps towards longer-term solutions for the affected population. Funds were mobilized through UN OCHA's Central Emergency Response Fund, the SURF, as you well know it, allowing the delivery of life-saving services to more than 15,000 refugees and host community members. Complementing this, the government has generously allocated land and invested in basic infrastructure to accommodate the refugees while also allowing access to natural resources and services to transition to self-reliance. Malawi has yet to officially endorse the CRRF roadmap for implementation. Nevertheless, the government has been progressive in supporting refugees, even with the existing reservations to the 1951 convention. More specifically, refugees have been included in the Malawi Growth and Development Strategy in its third iteration. Land was also provided to facilitate shift from camp to settlement and for livelihood purposes. Both countries have further cemented their commitments through the pledges submitted at the Global Refugee Forum last year. However, the needs remain huge and contributions from the international community are really greatly needed to fully implement the roadmap and pledges made in the sub-region. At the 2019 GRF, as I was highlighting, the region received 134 pledges on asylum and statelessness from 14 states and 10 organizations. Currently, 44% of those 134 pledges are being implemented actively, while 12% are at the planning stage, and another 44% have yet to be started with implementation. A number of activities towards the implementation of the pledges have been put on hold as governments have had to shift priorities due to the ongoing pandemic, as we all can imagine. Despite the challenging situation, there is political will by states and pledging organizations to implement, as demonstrated by promising progress in some pledges, such as the following: statelessness-related pledges relating to accession to the conventions, the 54 convention and 61 convention have been implemented by the Republic of Congo, the Democratic Republic of Congo, and Namibia notably. Law reforms thereto also have been implemented by Madagascar, Lesotho, Malawi, Eswatini. Studies are also ongoing in Malawi, Zimbabwe, Namibia, Eswatini, Angola, and Zimbabwe. Strengthening birth registration is what we are currently implementing in the Republic of Congo. And another set of actions really is about strengthening asylum systems, specifically civil registration and documentation in Malawi, notably Zambia and the Democratic Republic of Congo. Inclusion in government socio-economic programs is also another portion of the actions that is taking place currently as we speak in Zambia and Malawi. For UNHCR and the Southern Africa Development Community, SADC, we are working together to mobilize and support states to implement the pledges and the GCR in general. A number of joint activities are planned, starting with a regional conference in the first quarter of 2021 to take stock of progress made and review and revise action plans and identify regional synergies to accelerate the implementation of these pledges. Slide number 4, please, and the last. Learning from the implementation of the CRRF and the pledges, successful operationalization of the GCR requires an enabling legal and policy framework. It is worth noting that many of the pledges by the states are towards the accession to asylum and statelessness conventions and reform or development of national laws that grant more rights to and facilitate greater inclusion of UNHCR's persons of concern, notably the refugees and asylum seeker. UNHCR is indeed working closely with government counterparts and is contributing its technical expertise to advance these efforts. Data on the socioeconomic status and needs of refugees or persons of concern vis-a-vis host communities is important to inform policy changes and programmatic intervention. UNHCR and the World Bank have set up the Joint Data Center to support global data collection, analysis, and dissemination. In the region, several data collection exercises are ongoing and planned. Plans to synchronize government and UNHCR information system are underway for better information sharing and management. Sufficient and predictable multi-year financing to address humanitarian and development needs of refugees and host communities really is critical. UNHCR therefore is strengthening partnerships with development actors and donors such as the World Bank, the Bureau for Population, Refugee and Migration, the US PRM, the private sector, and so on and so forth to make this happen. The World Bank, through the refugee sub-window, is funding the ROC's, Republic of Congo's social protection project, benefiting both nationals and refugees. In March this year, the World Bank approved additional financing for the Democratic Republic of Congo to improve access to livelihoods and socioeconomic infrastructures in vulnerable communities, including those hosting refugees. The COVID-19 outbreak has been a disruptor to the provision of protection and assistance to refugees. 6 states in the region, as we speak, still have their borders closed. These include Angola, Lesotho, Comoros, Madagascar, Mauritius, and the Seychelles. Cases of refoulement, that is the pushback on asylum seekers who are trying to seek safety. Cases of refoulement occurred in 2 countries, notably Botswana and Malawi. And refugee status determination systems are not yet operational in 7 countries, including Seychelles, Malawi, Comoros, and Mauritius, as well as South Africa, where we are, Angola, and Namibia. Efforts are ongoing to ensure that we unlock the bottlenecks. As a result, COVID-19 has also challenged fundamental norms of refugee law, particularly the right to claim asylum and the principle of non-refoulement, as just stated. To conclude, I really want to say that COVID-19 has slowed down the implementation of the GRF commitments due to stretched resources and capacities for the governments. However, it also, COVID-19, offered opportunities to advance the inclusion agenda, recognizing the disproportionate impact on refugees and persons of concern. In South Africa particularly, the government expanded its social assistance to include both asylum seekers and refugees. This was not the case before COVID. In ROC, Republic of Congo, the World Bank funded a COVID-19 social protection response that benefits the poorer households, including refugees and asylum seekers. Education Cannot Wait, which is a specific project, issued funding to the government of Zambia, notably to support continued access of children to education. I wish to stop here and really would stand by for answering any question that may come through the Q&A or live. I thank you for your kind attention.
Thank you, Angel. Thank you for that very comprehensive view of what is happening in the implementation of the Refugee Compact in Southern Africa. I'll now hand over the mic to Lily Sana, who will also give us an overview of the Migration Compact and how that is being implemented and embedded in South Africa and I think SADC. Lily, perhaps if you could keep your comments to 6 minutes, we'll give you time to complete and finish anything that you haven't yet. Please go ahead. Thank you very much.
Good afternoon, everybody, and thank you very much for this opportunity. I would just like to build up on the submission that has been made by my colleague from the UNHCR, just by indicating that we have two global compacts, and she's talked about the Global Compact for Refugees, and we have the Global Compact on Safe, Orderly, and Regular Migration. So the Global Compact on Safe, Orderly, and Regular Migration gives us a framework for international cooperation on governance of international migration. And I would like to highlight maybe two things as I make my submission. That one, the Global Compact was adopted in 2018 December in Marrakesh by the member states after the situation that had happened. We'd had a huge influx and mobility of migrants then in the Mediterranean and globally, and the UN member states came together and agreed that it was important for member states to make a commitment on how to address international migration. The second point that I would like to highlight that, so in 2019, there was an agreement that out of the 23 objectives that were highlighted in the Global Compact, that it would be important for member states to prioritize. So this was a string of commitments that member states made, and also the Global Compact is managed by some guiding principles that it would be important to start the implementation. So that was in 2019. Then in 2020, we, of course, were impacted by the COVID-19. And so obviously all this, that context to a certain extent has had an impact on how the Global Compact on Safe, Orderly, and Regular Migration has been implemented. The point that I would really like to highlight, and my focus will be towards South Africa, and just highlight a few points. That one, South Africa remains the main country of destination for migrants in the region. And when I say the region, I would like to talk about the SADC region and say that a significant number of migrants from the SADC region move to South Africa looking for opportunities. And just as my colleague from UNHCR has talked about the refugees, we have two categories of mobility, of human mobility. So one is linked on people looking for international protection, and then another category looking for economic opportunities. And so obviously that also has an impact in the country. So people come in looking for economic opportunities, and we see that in the SDGs, that migration is recognized as a development agenda when you look in the 2030 agenda. And however, coming into South Africa, migrants come in different flows. Either some flows are regular, people coming in with the regular documents, and some are irregular, people coming in looking for opportunities but without the requisite documents. So here we are talking about either migrants, refugees, asylum seekers, and others. And for a country like South Africa, when we go back to the GCM, South Africa has been involved and South Africa has been engaged on the international stage. They participated in the adoption and they are a signatory to the Global Compact. So that means that they have a commitment towards the implementation of the Global Compact. However, migrants also sometimes face incidents of stigma, discrimination, and xenophobia in South Africa. And one of the things that the South Africa has tried to do since 2019 is to address issues around xenophobia and discrimination. And they've come up with a policy, and they have a national action plan to address aspects around discrimination and xenophobia. And some of the practical aspects of implementation that the government of South Africa is doing in collaboration with the UN and the private sector is working on aspects around social cohesion. And through the Multi-Partner Trust Fund, which is a funding mechanism that was established by member states to implement the GCM, we, as the UN and with the government of South Africa, were able to access some money from the Multi-Partner Trust Fund, and we are supporting the government to implement a project on strengthening migrant integration and social cohesion, and also through looking at social economic activities and countering anti-migrant narratives in South Africa. So that is one practical aspect of the implementation of the GCM that the government of South Africa is looking at. I would also just like to submit that the Global Compact is a framework which is still relevant because it focuses on strengthening international cooperation, particularly during these days of COVID, as the COVID-19 pandemic presents itself as a health crisis, as a social economic crisis, and also it has protection issues around it. And when you look at the Global Compact on migration, it has been clustered into 5 thematic areas that talks about regular pathways, that also talks about the importance of having data or evidence so that whatever interventions that we make, they are informed from an evidence perspective. And I would just like to basically just stop and say that the importance of the GCM in itself is in the sense that it gives a country an opportunity to address migration issues from a perspective of its context. So, it talks about the aspect of national sovereignty, where a country then will determine what is important for them. But then from a perspective of from a regional perspective, member states can come in and address the issues around migration governance jointly because of the transnational nature of migration. I would like to stop there and then just will be willing to take any other questions or clarification.
Thank you, Lily. Thank you, Lily. And thank you again to Angèle. I think we now have a broad understanding and snapshot of where the Global Compact on Migration and Refugees is in terms of its implementation in the SADC region and for the GCM in South Africa. I want to now turn to folks in civil society to give us a perspective from where they're at about how about their own experience with the global compacts and whether these frameworks have actually enabled or supported their own efforts in protecting refugees and migrants. Maybe I'll open the floor to Barnaby Kangoni, the health director of the JRS, to give us some of his some of his experiences and understandings of what is going on the ground. Barnaby, yes, thank you. Barnaby, we cannot hear you. Are you there?
Hello, can you hear me?
Yes, we can hear you now. Yes.
Okay. Thank you very much, Carol, and also to Joe for inviting me to this discussion. So my presentation is going to be very brief. I'm just going to share with you some experiences that we are finding in the field. So what we are doing, I'm working for an organization called Jesuit Refugee Service. I'm sure some of you have heard about it. And then what we are concentrating on is provision of healthcare services to refugees, asylum seekers, migrants in South Africa. And we are looking at the provision of all kinds of healthcare services. So from your basic primary healthcare service and up to the tertiary healthcare services. So we've actually seen that in the field. I mean, during our in the work that we do, the refugees, asylum seekers, migrants that are in South Africa are facing a lot of challenges that are happening due to probably it could be changes in policies, but which are not shared to everyone or made known to the public. And then at the end of the day, it is actually giving them problems. So these are some of the issues that we're looking at as JRS and to be able to tackle some of these situations. Now, we've had a lot of our clients who have been complaining and facing difficulties of trying to have their documentation renewed. Because here in South Africa, a person gets an asylum seeker permit, which is only valid for 6 months. So as it expires, when they go back to refugee reception office, they are getting challenges that it's either they are not accepted to in the offices, or they are being asked to actually go back home, come back another date. So if they have their document, if it has expired, instead of getting a new document, they get their old documents stamped. And then that stamp actually works as, well, in inverted commas, as the kind of like renewal of the document, but then they don't really get the original document that they are supposed to be getting. So our asylum seekers and refugees, they are constantly having problems with the law enforcers now when they are in the community, because the setup here in South Africa, we don't have any refugee camps, but our refugees and asylum seekers, they are actually integrated in the community, and then they are living in the community with the rest of the locals. So at the end of the day, they risk that chance of being persecuted by the law enforcers simply because their documents are not up to date. And then some who would want to apply for refugee status, it is nearly almost impossible for a person to get a refugee status here in South Africa, because there is a huge backlog at the Department of Home Affairs, and people who have had asylum seeker application into refugee status have been waiting for as long as over 10, 15 years to get just a refugee status, you know. But it's something that the Department of Home Affairs is failing to clear that backlog, and most of our refugees are facing problems to get the legal document. And then for those who actually do have the refugee status, they are not getting any assistance from social services, like the South African social security agents to get some kind of financial assistance or a grant that can actually help them, simply because it all boils back to the issue of the backlog, which is taking forever to be cleared, and at the same time, just being foreign and not getting the right treatment is the biggest challenge. So one greatest challenge or fear that we are seeing is the institutional xenophobia that is actually happening. There are policies that are made towards the provision of healthcare services in South Africa. But then these policies, they get changed and it's silent. People don't get to know about it. And then at the end of the day, when our patients or our clients visit healthcare service centers, they don't get what they're supposed to be getting, the healthcare service that they're supposed to be getting, simply because there are policies that have been amended but has not been shared with the other organizations or with the general populace, so that they actually know about it. Like, for example, we in South Africa, we've got a system of payment whereby the migrants, I mean the foreigners, according to their income status, they are supposed to be getting, they're supposed to be classified as H1 patients, which means they are of low income earning. And then they get either free to just a minimum amount of what you call this, consultation fee that they're supposed to pay. But then this has been overturned, and then they are all now pronounced as private foreign patients, and then they are asked to pay exorbitant amount of fees that they can't even afford to pay. So this has become a challenge to our most of our refugees and asylum seekers. So it becomes now kind of like an institutional xenophobia, whereby certain policies are now being amended, and they are not in favor of the refugees and asylum seekers. So what we are doing now, let's looking at the COVID-19 pandemic itself and how it has affected our refugees. We have actually seen that, I mean, this is a global phenomenon and it's a global challenge. And we see that most of our patients, I mean, most of our caregivers or breadwinners, they lost their jobs.
Barnaby, I'll just give you another, Barnaby, just one more minute. We'll come back to you in more detail as the conversation goes on. Please just wrap up.
Okay, so yeah, basically those are some of the challenges that we are actually facing in the field, and how our refugees, asylum seekers are facing. So we'll talk more if needed, if you need more clarity on this. Thank you, Carol.
Thank you so much, Barnaby. I mean, we've seen, so there is some progress, but on the ground, we still have facing challenges. And I want to get Sharon really to give us a snapshot of her experience at the Lawyers for Human Rights in protecting migrants and refugees. Sharon, just please, we will bring you back in. We want this to be a conversation, but just wanted to allow people to just give us a brief overview of their own experiences. So please go ahead for a few minutes.
Thank you, Caroline. Thank you very much. So just following on Barnaby, I think it'll build on the points that he's raised. So during the lockdown, I think, we remember, and it feels like a nightmare to go back. There was this very strict level 5 lockdown declared in March this year. And what we, with other partners in civil society, including and particularly the public interest litigation sector, we saw that the pathways to ensure accountability of the state for infringements of human rights was extremely limited. So against that backdrop, there was an incredible collaboration with LHR and about 13 other organizations, including the Socioeconomic Research Institute, Indifuni, Ikwazi Law Pro Bono organizations, and other, for-profit law companies which came on board to do pro bono work. And we set up a hotline. And so I'm going to just briefly give you the statistics of the calls that came to that hotline to give you a reflection based on data, research, to demonstrate the impact, the disproportionate impact of these strict regulations on poor people, on marginalized people, but in particular on refugees and migrants. So in total, we had about 3,000 calls over the last 8 months. And we've been able to respond to those calls and to respond to them with legal support and where possible to intervene. Now, the sectors that were disproportionately impacted on, the marginalized communities, included precarious and informal workers. And we know from our experience that this sector has a large number of migrant workers and asylum seekers who find that space as the only space for livelihoods in this country. Then the urban poor, the homeless, and people that need to go from day to day for their survival in order to be able to earn some way of existing. So what we found was that, in the very first week of setting up the call, we had 58% of the calls during this period was related to unlawful evictions, landlords throwing people out during the global pandemic. And yet the regulations made provisions to call for a moratorium on evictions because of this global pandemic. And so there was no other means of legal recourse other than people trying to access through the hotline and for us intervening and trying to assist. Also in the very first month, and this pattern continued right up to the current month where we are tapering off the service, over 20% of the calls reported incidences of police brutality. And both these statistics, there was in itself, aside from being very marginalized people in our country, there was a higher percentage of people from the migrant asylum refugee community. So, I think that this reflects for us the fact that the Global Compact didn't really assist in ensuring that there was an inclusive response from our country, from our government to the COVID crisis. And I think that the other big problem, sorry, just one positive thing is what got formed as a response was civil society got organized through things called the community activist networks. And these community activist networks is largely what we used in ensuring that people received social security. So what I didn't mention was we had over 700 calls immediately for social security. Now, while the government was taken to court to force it to expand social security to asylum seekers and refugees, I think to date about 5 or 6 asylum seekers have actually got that grant if they did. And we had 700 calls and we had to find food parcels to assist. And it was the community activist networks that came to our rescue. And they provided food parcels and other support with no means test. You registered because you needed social security and you received your food parcel, whether it was on a weekly basis or a bi-weekly, depending on what was available. So I think that just very quickly, for me, that's a snapshot of how this COVID and the regulations unfairly affected people who don't have the luxury of social distancing if you have a home and a private home and you have those kinds of luxuries that class gives you. And I think that it raises serious questions about and exposed the incredible inequality in our country. Thanks, I'll end my points there and I'll take any other questions if there are for clarity.
Thank you, Sharon. Thank you very much. Our next speaker, we've been talking about the law and around how the Global Compact on Migration really marries or is able to intersect with global norms and legal protections for migrants and refugees. And our next speaker really has an interesting take on whether legal pronouncements really do protect refugees and migrants, and he'll come in and give us his take. Lauren Landau, sorry.
Sure, I wasn't sure whether you were speaking about me, since I'm not sure I'm going to talk about the law so much, but I think I would like to talk a bit more broadly about 2 trends that I've observed. And a number of the speakers have spoken about these indirectly, but I think it is important that we speak about them when we think about protection in the region in Southern Africa, but of course across the continent a bit more broadly. So the first of these trends is really a shift in what we mean globally by protection. And some of this comes from the Global Compact, but I think we're seeing it in other places also. And I think for many of us, protection it has always meant keeping refugees and migrants safe from hostile governments, from armed elements, from sometimes even domestic partners or the cultures that they've grown up in. And I think that that's shifted. I think that some of that is still there, and we've heard about that today. But I think that the kind of general ethos of protecting refugees and migrants from something else has shifted. And if we take the Global Compact, which we're talking about today, it talks about safe, regularly, and orderly migration. And that's fine. It's not easy to do, but that's fine. But I think if we look at how this has filtered out and into, for example, the UN Sustainable Development Goals, and I'm particularly concerned here with 10.7, if you want to get specific, which adds to that list responsible migration, right? And this phrase, with its emphasis on kind of migrating responsibly, I think it shifts what we mean and what the world has meant, and certainly governments have meant, by protection, right? So safe, regular, orderly, these are all things that states do to protect refugees. They create legal channels, they regulate, they refine procedures, etc. But responsibility is a different sort of thing. Responsibility puts the burden on migrants or people who might migrate to do the right thing. They've got to comply. They have to respect the rules. You got to think of it like migration is sort of like being a good house guest. You're only supposed to go when you're invited. You shouldn't stay too long. You shouldn't reorganize the furniture. You certainly shouldn't eat everything in the fridge, right? But migrants are not the ones setting the rules and opening the invitation, right? Quite the opposite. What's becoming evident that it's more and more difficult to migrate legally. it's more and more difficult to migrate without smugglers, to migrate within the law. And as such, it is almost impossible by that definition to migrate responsibly, right? And so while the need certainly to move and the desire to move are there, the possibility of moving responsibly is less and less, and right? And so the EU is shifting laws across Africa to try to tighten border controls, to try to make things more orderly. But the effect in practice is to try to make it harder. And certainly South Africa is doing everything it can at all sorts of levels to make it harder to move in a way that is orderly and that is responsible, right? And this is responsible not just because you're breaking the law, but there's a reframing that moving is bad for your community, it's bad for your country, it's bad for the continent, it's irresponsible to leave when you should be staying at home to try to build. And if you happen to die en route or be detained, that's the price you pay for acting irresponsibly. That's the rhetoric we hear. That's what we hear from states. That's what we hear from politicians. And that's going on. And I think COVID has made the possibility of moving responsibly even harder. Of course, people are still moving and the incentives for moving are even more than they were. But the language has shifted so that any kind of movement is irresponsible. I mean, South Africa has opened up, but we still talk about people moving. Every time you move, you put someone else at risk. You put yourself at risk. And I think all of this has given rise to what I've started calling, and Joe and Nick laugh at me for this, but a kind of chronoscopic form of protection, right? That's not a term that I came up with. I took it from science fiction. And if you see Minority Report, the Steven Spielberg, Tom Cruise movie, they talk about it there as kind of pre-crime, right? So in our case, the crime, the thing we're trying to protect people from is the crime that they're about to commit. What we're trying to do is protect migrants from themselves, to try to ensure that they don't put themselves and their family at risk, not once they've moved, but even before they move, right? And this means intervening very, very early, not to protect migrants, but to prevent them from becoming migrants or even to think about it, to so that they make the right decisions. They don't do things that hurt themselves and their communities, right? So we talk about protecting ourselves from migrants. In Europe, they might protect migrants when they die at sea, or the US puts kids in cages, but they say it doesn't have to be this way. We don't need to change our behavior. We don't need to create paths for them to come. They should stop coming. And in that way, they will protect themselves. If only they could just stay at home, right? And I think this gets to the sort of second trend, which I'm going to talk about, and I'm going to be as quick as I can here, Caroline, right? And this is sort of new initiatives that are building up around this idea of responsible migration, right? This is how do we keep people safe from themselves, right? And Europe is spending tens of millions of euros on literally on what they call swarms of autonomous robots, right? To track smuggling and other forms of technology so that they can intervene early in places where migrants might be starting to move and stop them from putting themselves at risk. But they're also doing a whole range of other things. Iris scans, monitoring your cell phone, your social media, building up border posts, investing in the census, population registry, satellites, all to identify and predict who is moved, who's gonna move, so they or the international organizations or others, government agencies, can intervene to stop them. But it's not a language of stopping them, it's the language of protecting them. We don't want them to move. We don't want them to put themselves and their families at risk. And on top of this, it's not just about these kind of interventions in the form of police or border controls. There's interventions that people are doing, IOM and others across the continent, which are about trying to encourage the idea of responsibility, which basically means only move when you're asked to move. They put in money in billboards and radio, TV, programs in schools, all designed to foster responsible behavior so that migrants and Africans will protect themselves from themselves, right? They talk about the EU is funding a project to protect or to correct Africans' misconceptions about what migration can do, to try to correct and protect them from the bad ideas they have that migration is going to be good for them, right? And I think lastly, we'll have to talk about what this means for us. We talked about data centers. We talk about the global compact. The first thing it says is we need more data. COVID has made this even more acute. Everyone needs data. We need data to protect our communities, to protect ourselves. But what is happening to that data? As we've heard from one of the previous speakers, it's being aggregated, it's being analyzed. AI is working on it. Is it done in the name of protection? Yes, but protection of the kind that I've been talking about, which is really effectively controlling, trying to stop people from moving, trying to stop people from causing harm to themselves. And it's feeding into a whole range of activities, right? That's being done at multiple levels: cleaning out slums, limiting informal trade, extending detentions, turning back would-be asylum seekers and migrants. These are all the things that we do, not to hurt migrants, but to protect migrants, host communities, and others from themselves. So that's what I think we need to be watching out for. Protection is no longer about protecting migrants from things. It's protecting migrants, protecting communities, protecting all of us from migrants themselves. Thanks very much.
Thank you, Lauren. Thank you for that shake-up. I think I'm hoping that the rest of the panelists will have something to respond in terms of what they've heard already. But before we get responses from the panelists about their talks, I'd like to start with, we have some questions which have been posed to some of the panelists, and I'd like to start with the first question around NGOs and civil society and funding. And the question is, are civil society organizations facing difficulties getting funding, particularly at this time of COVID, that is related to the protection of refugees and migrants? And maybe just a quick response from Sharon and Barnaby before we go to questions that have been faced, that there's a question here for Angel. Might there be anything to say on the split between the state's initiatives to care for refugees and the hardships, xenophobia, social exclusion, etc., that refugees may face at the hands of the host communities? And has the current COVID situation led to any qualitative changes in the treatment of refugees by host communities as an extension of the desired treatment goals from state actors? So those are two questions that we have to Angel and to the civil society panelists. I think, Anja, perhaps would you like to start, and then we'll go to Sharon and Barnaby.
Sure, I can definitely start and say that indeed, I said it actually even at the end of my presentation, to say that COVID has not only done bad, but definitely it has also done some of the things positively. And you may recall my High Commissioner had really been on the spot to speak about the imperative to include everybody and to include along the lines of the 2030 agenda, which prescribes us not to leave anybody behind. And I think COVID has only further emphasized that message, that indeed, if we would be a state and we would think that during the time of COVID, we will only target our own nationals for all the measures that we are taking to combat COVID, to preempt the pandemic from spreading, then we would really be misleading our own selves. And in that regard, we really have seen here in South Africa the tremendous effort that the government, the authorities have made to indeed include the refugees, to include the asylum seekers in the measures that they were taking. A colleague of LHR mentioned the food parcels and so on and so forth. We did see definitely a good will in regard to making sure that refugees are included in the response to the pandemic, and included not only as beneficiaries, but we also saw refugees who had expertise, including medical doctors or workers who had been used to indeed sensitize, to indeed combat the pandemic. And so I really think, yes, albeit the bad sentiment that we saw in the beginning, we indeed, I can't deny that we saw some situations of rejections, but in the longer run or in the medium run, throughout the lockdown time, we have seen that governments have opened up to admit that they better include the refugees in the overall response, lest they were going to defeat the purpose of their own interventions. So in that regard, I would say COVID did good. Over. Thank you.
Sharon and Barnaby, would you respond to the funding situation?
Yes, I think from LHR's side and from civil society, we have seen you know, the impact of COVID, whether it is because more funds have to go to COVID. We've seen from government side that the response to COVID has meant that cuts in budgets of different departments, which impacts on the provision of services to our constituency, and our constituency is the poorest of the poor, and they get disproportionately affected by these cuts in services. But ultimately, our funding has also been cut by UNHCR, and I think this is a direct consequence of, you know, needing to respond to the emergency. So there is definitely drastic impacts on our ability to do our work, and we're feeling the pinch. And I think that doesn't bode well for holding our democracy and strengthening our democracy and holding our states to account, but also ultimately for issues of protection of migrants and refugees and asylum seekers.
Sharon, could I ask you a follow-up question that has come through about whether you see the compacts on refugees and migration discussed at any fora, whether it's political, at civil society level, in the media in South Africa? Is there a buzz around the compacts?
There is, I mean, we engage with it because we are an implementing partner of UNHCR, and we engage as implementing partners, and we engage in when we're working with other NGOs. But I don't think that we had an incredible movement of people in South Africa calling themselves the C19, you know, COVID-19 response. And I don't feel that they were engaging with the Global Compact. I don't think that even with the diaspora community that there is enough being done to engage and to raise awareness and to make sure that we do live up to a very important principle of nothing about us without us. So that would be my response very, very quickly.
Thank you. Barnaby, do you have anything to add, or? Yeah, I see you. Please go ahead.
Yeah, generally, maybe I can just echo what Sharon just said, but then speaking on behalf of the organization that I'm working with, we've been receiving funding from our usual donors, and we've been actually trying to assist as much as we can, especially the clientele that we have. And we've managed to provide PPEs to people. We've managed to provide also food parcels. But then it could, the donations can only go up to so far, you know, but as it stands, it has been working on very well, but you know how it is. We've got a large pool of people who need assistance there, and we keep sourcing for more funding.
Great. Thank you. I have a question, I think, that is aimed at Lily. What has the South African government done differently since the Global Compact on Migration to include migrants? What issues around migrants are the funds derived from the Partner Trust Fund meant to address? And how sincere is the government in using the funds to deal with the migrant challenges in South Africa? I'm not sure if Lily is there or if anyone would like to respond.
Yeah, I'm here. Sorry, I was having challenges on muting. One of the things that I could say that has happened since the GCM, and particularly with the COVID-19 pandemic, through advocacy and discussions with the government, there was an acknowledgement that migrants also do need assistance. And through a solidarity fund that was established in South Africa, migrants were also included. And there was a target of about 5,000 migrants to be provided food assistance. So that was one aspect of advocacy, just to also make sure that migrants can be included. In terms of the second part of the question, which talks about the multi-partner trust fund, that there's been discussions, particularly with certain departments like Department of Social Development and Department of Justice, where the focus is also including migrants and also South African nationals who host migrants to get socio-economic support through the multi-partner trust fund. So there is some progress made from that perspective. Of course, we do acknowledge that there's still a lot more work that needs to be done in that area. Thank you.
Thank you. I have a question for Professor Landau. Has the lack of a nationally coordinated approach in South Africa to address the implementation of the two compacts resulted in its haphazard and selective implementation? And has COVID not actually forced government's hand to including refugees and asylum seekers after initially excluding them from relief measures?
That's a good question, and it's one I'm not sure I have the answer to, because it's asking, why the South African government inside has done things, why it's made certain decisions, and that's always something difficult to tell from the outside. I think the haphazard application of the compacts is something that we see around the world, where the states will pick the elements of the compacts that they like, including the data collection, the sort of border management, that kind of stuff, and ignore the parts that they don't like. And like every UN document, it's vague enough that states will agree, but it's also vague enough that states can implement it pretty much however they see fit. And I think South Africa has done that, in line with its own political priorities, which are generally to try to restrict the entry of migrants and to restrict their rights in the country. I think the inclusion of, maybe our colleagues from the UN could explain why they've switched on the inclusion to sort of relief grants and others. But I think that while that might be the case in the short term, we've been fighting for years to get them access to healthcare, to get access to schools, et cetera. And it doesn't feel like we're making much progress. And my sense is we're going the other way. So I wouldn't be so sure that the compacts are going to have much in the way of disciplining power in that regard.
Right. I have a question, I think, to all the panelists, particularly around your intervention, Professor Landau. When Professor Hakan started this conversation, he really talked about how the global compacts were implementing or were aligning with sort of international norms and global norms on human rights. And you've raised the question around how these compacts can sometimes are providing the opportunity for states to undermine human rights through the technologies that they're using to trace people and to track people. And I'd just like to get a response from the other, particularly the UN and IOM colleagues, around how the GCM really is going to address those kinds of questions around targeting migrants before they even commit a crime, the crime being to move, which is not really a crime.
If I may, maybe.
Okay.
Please, Angel.
Thank you. In fact, and pardon me if I would a little bit go back to some of the matters that were raised by some of the discussioners or the panelists, to say, first of all, to Barnaby, I heard you about the issue on documentation and the issue on the backlog. And I really wanted to say that in that regard, we are really striving to solve the root causes, which is that the documentation becomes problematic because people remain in a sort of legal limbo for a protracted time frame. And it is very much linked to the backlog issue that you raised about asylum seekers who remain in the process of eventually being recognized as refugees for too long. And there, I want to say that indeed we have been working on this with South Africa, and we have seen that thanks to the pledges that were made, indeed, as a follow-up to the Global Compact on Refugees, South Africa just this month, actually, agreed to be part of what we call the PROTECT.project, which is a sort of, I wouldn't say global, it is actually global project, whereby we really are busy matching countries that are in need of support to do away with their backlogs in terms of determining the refugee status of those who are found in their midst, and those countries who have the means to provide such support. It could be technical, it could be financial means, and South Africa just agreed to do that after our High Commissioners visited South Africa last year and particularly advocated for this. And so I wish to say that really, all in all, I do think that, I do want to place a caveat here that I am also optimistic. Some of us definitely are optimistic about what the GCR, more I would say specifically the GCR, the Global Compact on Refugees, can really do in terms of further galvanizing the synergies in the world in order to tackle the issues of forced displacement and find lasting solutions. And there I want to connect it to the intervention of the Lauren to say really, in as much as what you were describing, the issue of prevention as opposed to protection, I really very much agree with it in terms of migration. But when it comes to refugee prescriptions, I definitely want to say that there is a nuance to be seen there. Definitely, as somebody who has been working for refugees, a protection officer, I see value in preventing people from becoming refugees, because this is not a glorious status. It is actually a victim sort of situation. So we, in as much as we can, we are advocating for member states, for stakeholders to solve the root causes that are eventually generating refugee situations. And in that regard, yes, prevention for us is glorious. Yes, prevention is the way to go. Now, when it has already occurred, we also call for rapid intervention, rapid response, and appropriate response, comprehensive response, so that we can comprehensively solve the issues that are generating forced displacement, and indeed put about an end to the situations of those who are forcefully displaced, because these are not enviable situations. These are definitely situations we wish no one to be in. So I really wanted to specify those two caveats, to say that yes, we are working on it. I beg pardon, Caroline, if I have a little bit forgotten the specific of your question. I have gone back to answer these caveats.
Thank you, thank you. There's just a follow-up question, I think, for Lily, with how this data collection, what the risks are, around this data collection on migrants, and whether it actually is providing the kinds of protections that are envisaged in the GCM.
Thanks, Caroline. And I would also just like to reflect a little bit on the point that one of the panelists, that Lauren made, just to really indicate that when we talk about responsible migration, and highlight the fact that it's important to have international cooperation around all member states, the point is really to stress that if we address the push factors, because when we look at migration, we have what we call the drivers of migration. And some of the drivers of migration are linked around governance. And so to a certain extent, if those aspects are taken care of, it will contribute a lot more to people making informed decisions when they are choosing to move, and to a certain extent also contributing to them making responsible choices when it comes to making decisions on moving. But of course, that is something that we can, it's a long discussion that we could have around that area. But now coming back to the point of data, one of the aspects around data is the importance of having evidence that gives us then a good understanding of issues around migration. So for instance, when in a country like South Africa, if we say that all migrants are taking certain jobs that belong to a particular population, that area, it's important to do further, to collect more data that can give us a better understanding, like for instance, what kind of jobs are held by migrants, or it really, if we do a further analysis, we can have then a better understanding that informs that discourse on the fact that maybe migrants are taking jobs away from the nationals. Now, when you talk about the danger, how do we ensure that we are protecting personal information that could be used to the detriment of the individual? One of the factors around data that is collected is also what we try to do is to ensure that it is not linked to an individual. For instance, you anonymize it. That's one of the ways we use data, such that you would not really be focusing on female named Lily Sanya, but it could be females of a particular. So it basically depends on the purpose that you are using, or the purpose that you're collecting that data for. I'm not sure if that was the question, or maybe I didn't get it right.
Thank you, Lily. I think, folks, we are coming very close to the end of the discussion, which has been really exciting, and thank you for all who have participated on the chat. Just one very quick question to Lily and Angel. Are there any dialogues between the UNHCR and IOM regarding points of intersection? Please, because we're just, are there? And the question has been asked by Hakan, and maybe you can also follow up with giving him some examples. But just to say very quickly, is anything happening between the two organizations?
I wish to start. Yes, I should say yes, and it didn't wait before, until recently, until we got the compacts. We have, from day one, from the time I have joined this organization, I have seen that there have been partnerships. We have been always working together. UNHCR and IOM, I do recall when I was a protection officer, catering also for resettlement. Definitely IOM was handling the all the logistic part of resettlement. When I had finished determining that so-and-so family needs to be resettled so-and-so places, and the moment they were accepted, I would hand over the folder to IOM, and they would take it over from there. So it has always been a very collaborative approach for me, from what I have known it. And we have, if I'm not mistaken, we have memoranda of understanding. And in terms of, especially for internally displaced persons, as you know, this is a collaborative approach, an interagency collaborative approach for the UN. IOM and UNHCR definitely collaborate a lot, be it for the data collection, actually, before the DTM came, and even while the DTM is in place, UNHCR does always complement it with what we call a vulnerability assessment, and so we work hand in hand to have those data and to ensure that we can use them together as UN country member teams, actually, which we all are now. And in terms of when you take shelter and non-food items cluster or sectors in the response for internally displaced persons, UNHCR and IOM are always members of that cluster. And the camp coordination, camp management cluster also is another one where we do collaborate a lot. Of course, the protection cluster, indeed, IOM is always a member of it, while UNHCR is coordinating and so on. So yes, there is a lot of interaction between the two agencies, because many times we have points of intersection, and so we do need to work together. Over.
Thank you, Angel. I think you've answered on behalf of Lily. I'm really mindful of time, and I want to respect people's time here for having come to spend this with us, listening to us. Lily, maybe put something in the chat if you have anything to add for Angel on top of what Angel has said. But I think this is now the wrap up, and what I'd like to do is probably ask Professor Landau, who is from the ACMS, to just kind of wrap up and give us a sense of his reflections on the conversation.
I think that maybe we can ask Joe rather than me, since I've been a participant. I have my own perspectives, things I agree and disagree with that have been said, but maybe we can turn it back to Joe. If you don't mind, Caroline, I feel like she'd probably have more to say.
No problem. Joe Very, I think we can hand it over to you.
Thank you so much, colleagues. What I'll do is I'll wrap up and sort of close the session with some thanks, but also just a couple of reflections that I hope help tie together some of the tensions that have been raised around the roles, or the roles that aren't existing around the role that global compacts, international agencies, connections to service providers present. And I think that whilst we know we don't want to fall into the trap of looking at COVID and kind of COVIDizing all of our work, it is providing a unique opportunity to look at the way that migration governance is being used, abused, reappropriated under the guise of responses to COVID. And I think one of the key things is that we are doing work at the moment looking at responses across the continent, and I popped some information in the chat box. And what's really key is that the research has once again highlighted the essential role that human mobility plays on the continent. So I think we have to be very careful about this rhetoric that we seem to be returning to once again around finding ways to prevent migrants from moving. This idea that we can somehow develop developmental interventions which are going to prevent migrants moving. And what we have to recognize is that's not how the world works, it's not how the continent works, it's not how as humans we work. And we need to better recognize this essential role, and that our responses when thinking about mobility in all of its many guises need to be thought through. And secondly, is something that many of us in the kind of public health, global health security space have been concerned about for a long time, and we're seeing this now play out in the context of COVID, is that COVID has provided states with the opportunity to tighten and to restrict the movement of people across borders. And we're seeing in some contexts in different regions across the continent that COVID is being used to legitimize an increasingly securitized response to immigration. And by that, what I mean is increasingly restricting movement. However, the responses that have been developed are around the movement of goods and services. So we see this very different approach to what borders look like in the context of COVID and whose lives, as it were, matter. And as we know from previous work and established research, that closing or fortifying borders doesn't stop movement. And what it does is it means that movement continues, but it becomes more dangerous. There are increasing risks taken by individuals moving outside regular channels. And this has implications for the safety of people in the current moment, in particular for individuals who are moving, and the wider public health and the health of populations, because we know those moving irregularly are left out of disease control mechanisms at formal points of entry. And this is something that requires a different view of the way that the compacts and the way that states and the way that the African Union and the regional economic communities need to be rethinking what the idea behind restricting movement means for health for everyone. So I'm going to leave it there, and just to close with saying many, many thanks, of course, to our fabulous panelists. Thank you so much for joining us. Huge thanks in particular to Caroline for doing such a wonderful job in managing everyone. Big thanks to Nick Maple, who has been instrumental in organising the panel, to Mari and the team at PROTECT for your support in developing and promoting the discussion and the panel, and to all colleagues who have joined us. I believe we had around 40 people who attended, and I hope people found something helpful here for our wider discussions, and we'll be making the recording available. And yes, please do take a look at the points that I put in if you're interested in joining us on the 11th of December for the launch of this AU report, looking at migration governance responses to COVID. We'll be sharing information about that through the PROTECT communication channels as well. Thank you, everyone, and goodbye.